Hi, this is Dr. Fox. Let's talk about Horner syndrome. In this video, we'll discuss Horner syndrome and how its symptoms illustrate the targets and functions of the sympathetic nervous system in the head. So Horner syndrome is the result of an interruption of that sympathetic pathway either within or between the brain and the remainder of the head. And it may either be congenital, meaning present at birth, or acquired, via injury or infection. Now, there are three major types of Horner syndrome. There is first-order Horner's. First-order Horner's occurs when the injury occurs to the pathway in the central nervous system, so either the brain or spinal cord. There is second-order Horner's syndrome, and this is when the preganglionic pathway, so this would be between the spinal cord and the sympathetic trunk, or up to the ganglia where that preganglionic neuron is going to synapse, or third-order Horner's. Third-order Horner's involves the postganglionic fiber, so between the ganglion and the target organ. Keep in mind that all preganglionic fibers that enter into the cervical sympathetic trunks are going to do so from the level of T1 through L2, which means there are no inputs to the cervical sympathetic trunk in the neck. These all are going to occur at the level of T1 or below. So Horner's syndrome may include a variety of symptoms, but generally an interruption or a disruption of the sympathetic pathway to that superior cervical ganglion, which services the head, is going to include unilateral, that means on one side, and it will be ipsilateral, meaning the same side as the affected pathway to that superior cervical ganglion. Miosis. Miosis means a constricted pupil, and sometimes it's very difficult to see a constricted pupil. Let's look at it on this side so we can compare the size of that pupil to that pupil, and we can see that this pupil is indeed constricted. On individuals with brown eyes, it can be a little harder to tell. So the size of the pupil is a consequence of intraocular muscles. So there are two sets of muscles. There are dilator pupillae muscles and sphincter pupillae muscles. Dilator pupillae muscles are innervated by sympathetic fibers. Sphincter pupillae muscles are innervated by parasympathetic fibers. In the case of Horner's, there is denervation or a loss of innervation to the dilator pupillae muscles, which then leads to an imbalance between the dilator and the sphincter pupillae muscles, and as a result, the sphincter pupillae muscles win out and we have a constricted pupil. There is also unilateral ptosis. Ptosis is a droopy eyelid, so there are sympathetic fibers that innervate a specific slip of smooth muscle that inserts on the superior tarsal plate of the upper eyelid. This is the levator palpebrae superioris muscle, a component of it, and when that muscle is denervated through a loss of sympathetic tone, the eyelid becomes a little droopy. So this is known as ptosis. A third potential symptom of Horner's is something called pseudo-false enophthalmos, which means a false sunken globe. With ptosis comes the general appearance of a sunkenness of the eye, and as a result, the person looks as though the eye is somewhat sunken. Another potential symptom of Horner's syndrome is hyperemia. So hyper means more or in excess, and emia references blood. So with hyperemia, the skin has a very flushed appearance. And this is because there is a loss of innervation to the smooth muscles of the wall of the arteries. So those vasomotor fibers are denervated, and there is a relaxation of the wall of the artery, and more blood rushes to the skin as a result. There is also a potential for unilateral anhidrosis. So an without hydrosis, water or sweating. And this is a consequence of the denervation of the pseudomotor fibers, which serve the sudoriferous or sweat glands of that region. So among these symptoms of meiosis, ptosis, pseudoenophthalmos, hyperemia, or anhidrosis, generally there's some suite of these symptoms that are present in an individual with Horner's syndrome. So we've discussed Horner's syndrome generally and what symptoms of Horner's may present and why this is reflective of various targets of that superior cervical ganglion in the head. This is your summary slide. Thank you for your time.